Hey everyone, welcome back to Pediatrician Brothers. Today we're diving into an important pediatric topic. It's short stature in children.
That's right, David. We'll explain what short stature means, how children normally grow, and the steps pediatricians take to figure out if a child's growth pattern is something to worry about.
It is important to document child's growth and plot percentile growth charts from birth to correctly assess the trajectory of growth.
On the screen, you can see now the sample of boys' growth chart where you can see age on x-axis and measurements on y-axis. Your doctor or even a parent can easily plot this chart if we can get the child's measurements at the age.
Yes, it is extremely easy. You simply plot wherever the age and set measurements intersect. For example, if child is 12 months old and the weight is 10 kilograms, and if length is 82 centimeters in measurements, and you can see it in the video. Let's start with the basics. Short stature is defined as the height that is more than 2 standard deviations below the average height for children of the same age and sex. So basically, if the height is below this line,
it's important to remember that many children who are short are not sick at all. In fact, the most common reasons are simply genetic factors like family and short stature or a condition known as constitutional delay of growth and puberty, which is a normal variant.
Now, how do kids normally grow? Pediatricians talk about 3 main phases of growth that we should remember: infantile, toddlerhood, preschool, early childhood, and puberty.
Exactly. In the first couple of years, kids grow super fast, up to 30 to 35 centimeters even a year. Then during childhood, growth is more gradual, and when puberty hits, there is a spurt that can add another 8 to 14 centimeters per year.
That's correct. The growth is not exactly linear. It's a continuous process with ups and downs. For instance, even during infancy, some babies might channel up or channel down across the growth percentiles, and their growth is adjusted according to their genetic code.
We can also use a rule of fives, which helps us easily memorize average growth velocity, which is 25 centimeters in the first year, 10 centimeters per year from 1 to 4 years, and 5 centimeters above age 4 until puberty starts and growth velocity speeds up.
Another important tool to utilize is calculating projected height of a child according to their parents' current height. For this, many online calculators are currently on the website available. However, if you don't want to use them, you can calculate by yourself.
When a child's height seems low, doctors start by asking a few key questions and measurements. What is the length or height of the child? The second one is their height velocity, meaning how fast they are growing, and if that is normal, how does the child's projected adult height compare to their family's average?
These questions help guide further evaluations. First, accurate measurements are essential. For infants, doctors measure length while the child is lying down on the flat surface, and for older kids, they use a standing height chart.
And by plotting these measurements on a growth chart, we can detect any abnormalities in growth patterns, and if the child is following a normal channel or if the child is falling off the track.
One informative tool in pediatric growth evaluation is the bone age test. Simple X-ray of the left hand and wrist let doctors see if the child's skeletal maturity matches their age.
If the bone age is delayed, it can indicate constitutional delay of growth or delay of the puberty. But a delayed bone age might also hint at other issues like nutritional deficiencies or even growth hormones, not mentioning other endocrine disorders.
Right, and alongside bone age, there are methods to predict adult height, like the Bailey-Pinot method. These predictions can help to determine whether the child is likely to catch up as they grow or if the short stature might persist.
So, when is short stature a red flag? First of all, if a child's height is more than 2 standards deviation below the mean. The second of all, if the growth rate is lower than 5.5 centimeters between 2 and 4 years of age. If growth velocity is less than 5 centimeters a year between 4 to 6 years, and 6 years to puberty, if the growth velocity is lower than 4 centimeters in boys and lower than 4.5 centimeters with the girls. And if the projected adult height is significantly lower than their parents' height would predict, right, as David mentioned in the calculation.
Additionally, if there are other concerning signs like weight loss, for example, or signs of systemic illness or unusual physical features, a more detailed evaluation is needed. This could include lab tests, for example, to assess thyroid function, celiac disease, or even genetic tests for some cases.
Doctors typically start with basic evaluation. First of all, we review the growth chart. We check what is the height velocity and what is the parental height, which gives us an estimate of the child's genetic potential.
If there's any sign of underlying condition, like significantly slowed growth rate or additional symptoms, they might order blood tests, imaging studies, or even refer the child to pediatric endocrinologist.
We hope you found this video breakdown helpful. If you have any question about pediatric growth or want us to cover another topic, please leave a comment below.
And please don't forget to like, subscribe, and hit the notification bell so you never miss our latest videos on the pediatric health. Thank you for watching.
Goodbye.